Hello, good afternoon. My name is Dr. Kulmeet Kundlas, and I'm a primary care physician in Central Florida. I have practice in Sebring and Lake Wales. Thank you for joining this YouTube live session, and it's being also uh, broadcasted on Facebook Live on our page, Shield Medical Group. In this, we will like to discuss with you regarding setting up achievable health goals in 2024. That way, you can live a better and quality filled life. It is my experience that every year we all make some goals which are very emotional and sometimes not achievable. They have all the good intention behind it, but they need to be rooted in science and also need to know yourself and work with yourself because this is a fight with you, with yourself. So I have decided that I should kind of start the year with the YouTube Live, the first real formal YouTube Live with this session regarding setting up goals in 2020. Before we go further, like as a physician, when I see the patients, there is a lot of confusion among patients. What is their annual physical or a wellness exam means? And I just want to first will go over and explain what this annual physical exam means. Then I will go over what are the particular test age appropriate needs to be done. Then I will go through different agencies like CDC and United States Preventive Services Task Force, what their recommendations are, and then certain takeaway points. That way you do not leave this session without clarity in mind, and you should be able to talk to your primary care physician in a very scientific and understandable and actionable items could be created from this one. So let's start. First, the key component is whenever I do physical as a primary care physician, my first goal is to make everybody understand what physical means. And I think the fundamental question, which is bigger than what physical is or what are the goal setting is, because we could set only those goals when we know ourselves. So first thing which I do repeatedly over and over with our patients is I try to explain who I am or what each individual is. As everybody's experience is, as you know, we all have a body, we have a mind with which we have emotions, and we have intellect, the critical thinker inside us, which tells us what is right, what's wrong, and what are the things we should do, what we shouldn't do that part. Then we have a spiritual domain of our life, which is the kind of our compass, which guides our actions and do this one part. Then we live in this outside the social environment. So what I want everybody to understand first is before we understand the goals and set it up, to know ourselves. The way I seen and the way I have been able to explain my patients repeatedly what this, who I am, if I could explain you clearly, I think that will make more sense to you in going forward. So let's start with the body. Body, out of five things which I said, body, mind, intellect, our spiritual domain, and the social. Body is the most honest. Body tells you if there is something wrong. Body tells you what is right, what needs to be done. It is very clear, very honest. Second domain of our life is the mind or the emotions. That is the part what we need to understand because that is what tricks us all the time. Say, for example, in the New Year Eve, we all think that I'm going to be able to lose 40 pounds of weight. I'm going to exercise every day. I'm going to sleep at the right time. I'm going to improve my relationships. But in the end, what happens is we are back to where a couple of days it happens, and then we are back to our normal habits, and we are not able to achieve sustainable goals. So we're going to spend some time to understand our mind, our emotions. Third domain of our life is is intellect. That is the critical thinker in us. That is the one which tells us what is right from wrong, whether we should do this thing or we shouldn't do this. Yes. And that is the one which analyzes the information and come up with a reasonable plan. But we need to understand is with when you try to set up the goals in the beginning of the new year that I'm going to lose 30 pounds of weight, I'm going to eat, that was your intellectualization. You are thinking with your critical analytical mind, which is telling you this needs to be done. But this critical mind is not in control. What is in control is your habits and emotions. And that is a 1,000-pound gorilla. And how we tame these emotions will go further into that in a minute. Then, fourth domain of our life is spiritual, which is we all have our own moral compass, which guides us what to do, what not to do. And I think this is very important. If we don't have a moral compass, there won't be any difference between animals and us. And then the last part is, which is also very important when we set up the health goals or any kind of goal, is our social environment. Let's first understand what is social environment is. Social, anything, so far I said four things: your body, your mind, your intellect, and your spirit. That is inside you. All these four domains are inside you. But the fifth domain, which is social, you consider anything which is not you is social. And if you look around, this social environment is made up of only five things. You have other people, places, things, events, and time. So let's elaborate. If you look around, wherever you are, there are people around you. You are at a home, you may be driving, you may be in a mall. That is the places part of it is. Then is the things. You are using some kind of device if you're listening to this live session, or you may be sitting in a chair, sitting in a sofa, bed. Those are the things. Then is the events. You have to go here, you have to go there. It's my birthday, it's my New Year's Eve. I have to go to job at this time. So fourth thing is the event. And then the fifth thing is time. Everything has to pass through the river of time. So if you look at it as who I am, and that's the message which I want to go before I go specifically into the goals, is that you need to understand yourself. You have a body, you have a mind, you have intellect, you have a spiritual domain, and you have social. And the social is made up of five things: people, places, things, event, and time. Now, let's talk it over more. What are the needs of these domains? Body. As I said, body is very honest. It asks for food, it needs to rest, it needs to sleep, and it needs to have entertainment. Body does not sway much. You could count on body. If you don't eat, it will tell you I'm hungry. But the problem is we eat when we are not hungry. That's not your body eating, that's your emotions. Because I like it, that's how we do this one part of it is. Second is your, so body's needs are food, rest, exercise, and entertainment. Now let's go to mind. That is where the crookedness of our human existence lies. Sometime I want this, sometime I want that. This time I want this time I want this thing. If I want to exercise, let's start tomorrow, and the tomorrow never comes in. Or I will go in the evening. So this is your procrastinator. This is the one you have to win over. Whenever we are setting up the goals, you whatever your intellect told you, this your emotions have to accept it, and you need to be fired up intellectually. Like if you go in the older way we used to describe conscious mind and subconscious mind. Conscious mind is your intellect, what you could think, analyze, perceive, and act, create an action. Subconscious mind is everything else what I told you, whatever happened in your body, that's your subconscious mind. that has a conditioning of millions and millions of years, our habits and the rituals which we go through that. So it is important that whenever we set the goals, we should emotionally also accept it. Not that self-will is a very weak, you self-will not carry you, willpower will not carry you for a long time. Willpower has a very limited band capacity. I was talking to one of my computer friend, and I asked him, like, they have kind of analyzed this. What is the, in computer language, if we want to know the capacity of how much is the power or bytes or megabytes of willpower we have in computer language, it's about 40 megabytes. And what is the rest of that is 40 millions. So your emotions, your habits, your rituals, it is compared to 40 million megabytes of a computer system which is driving you. And you want to be in charge with a 40 megabyte capacity of a computer. Yes, it can be cultivated, but you're going to need a practice. What I'm trying to say is, in context of setting up the goals, you must set up these goals in reflection your habits, what you do on day-to-day basis, what are the don'ts, what are your time constraints are, what are the other people who is going to impact your decision, what are the important events going on this time. So if you understand who you are, then you could understand your goal setting. Without understanding who I am and what are the components and how they affect you, I don't believe you will be able to achieve reasonable, sustained goals. So that is the lesson number one, or what I have understood it. Like in 30 years, any I have probably went over in different versions of it, my patients, probably I go over this thing 10 times and make them understand that they need to understand them before we could do anything which is meaningful and sustainable. Building with this relationship, now let's talk about the goals. So when you're setting up the goals, if there are 5 domains of life, your body, your emotions, your thoughts, your spiritual, and your social, so your goal setting, especially in a healthcare goal setting, it has to come through these 5 domains. So let's first talk about what body wants. As I said before, body needs food, exercise, rest, and entertainment. Now, if we let our body control this thing, meaning we eat only when we are hungry, we eat up to the point when it tells you to stop, we rest when it's tired, and we go to sleep, and we do other part, that if we start attune to our body and start listening to our body, I don't think we will have any chronic medical problems. Our problem is we do not listen to our body. What we listen to is our mind. Mind meaning your emotions. If you like something, you will go and eat it whether you're hungry or not. It's fine. It's supper time, you will go and eat. The breakfast time, we go and eat. Or now the things are social changes are, it's not that you even have to cook. Now it's very easy. You DoorDash it, you Uber it, the food will be there. All those things, when you eat, you don't sleep, you keep on playing. This is what your emotions are controlling. And that should not be the driving force. The driving force should be your intellect. So next part comes in into is what's the emotions needs to be done. Our vices, as Bible says, 7 deadly sins, that's what is referring to is our emotions. If we take our listen to our body and what Bible says in 7 deadly sins, we avoid them. I don't think our healthcare problems will be there. Lot of healthcare problems which should die. Next comes into intellect. We don't even think. The biggest disease is the emotions are driving us crazy. Neither we are listening to our body, neither we are thinking, and we are on an automatic pilot. anxiety, fear, stress is driving us, we are we are not in control. There is no technical difference between us and animals, that we are on autopilot. As a human being, we are not supposed to be on autopilot. Since we don't think, we do not listen to our spiritual domain either. Our moral compass is very short. We don't listen to anything. We don't do what we are supposed to do it. Yes, when there is significant catastrophes happen, then we think that we should have done the different way. So coming to that part, now coming to the social. If you look at your social with it, you could decide whatever you want to do that. If you do not take into consideration what is going on in your life, meaning if you don't know, if you say, for example, say, I'm going to start exercising and you're a young mother, you can't do that because you have to take care of your children, you have to take care of your other family members and everything. Before you make a decision, think of your social environment, how other people are going to impact your decision, how other places, things, event, and time, how this thing is going to play into that part. Now let's take up goals. The ultimate goal of every human being is two. Number one, to live as long as humanly possible and live as good as humanly possible. And if I have to, in 30 years of my experience, if I have to concise healthcare into two words, every doctor, every healthcare provider or institution is trying to accomplish two goals. Number one, to make you live as long as humanly possible. Number two, to have you live quality for life. And what is interfering in this one is our lifestyle. If now in the United States, number one reason for death is heart attack and stroke. Before we further go into that, technically, the number one cause of death in an ideal society should be aging. That you have lived long enough life, then eventually we have to go to our maker, and that's how we should die. But now there are two main, if you search a healthcare literature, you will find Brazilian things which can affect. But if as a society, if you focus on what kills most of us, it will falls into three things. Number one, heart attack and strokes. Number two is the cancers. And number three is the accidental deaths. So let's all these three, whether it's a cancer death or heart attack and stroke or accident, these are all lifestyle. So because we are not having a proper lifestyle, and the lifestyle is not determined by your body, not by your intellect, not by your thoughts, not by it's by our emotions. Because we are not connected with our body, our thought process, our emotion and spirit, we basically are living with seven deadly sins. And I think that is what is driving our all pain, suffering, and misery. Let's take it into details now. Heart attack and stroke. Heart attack and stroke are the number one killer in the United States and worldwide. And I'm from India. When I came to the United States 30 years ago, the number one reason in India for death was infectious diseases at that time. And if you didn't had any infectious disease, you died gracefully in a very old age, and you enjoyed your children, grandchildren, and 99% of your great grandchildren. But now, with the westernization in India, pretty much when it's the same way. Now, number one reason of death is also heart attack and stroke. So what has happened is the prosperity has not only improved our living, it prosperity has made us lazy. We don't eat right, and we don't exercise, we don't entertain ourselves, we don't think, we don't connect to our maker. So we are pretty much all societies across the board now they are living the same kind of life. And I think that's a curse of possibility prosperity, that our lifestyle changes. Our lifestyle becomes more comfortable, and this comfort leads to all these medical problems which we are talking about. Now, let's in heart attacks and strokes. Three things basically lump up in this group. There is heart attack, stroke, and if you have any gangrenes or EAD with the perforated, all these things look together through the same one process, which is called atherosclerosis. So they all pretty much will fall into that. But if you look at what are the reasons we develop heart attack and the stroke and PAD is, number one, diabetes, hypertension, hyperlipidemia, obesity, and smoking. So if you look at it as if we don't gain weight, we don't become diabetic, our blood pressure stays pretty much normal most of our age. With age related, as we age, the blood pressure will increase some, but not to the level that it will give you heart attack and stroke. And then diabetes is a purely comes from things. Number one, lack of exercise and our eating pattern. So as the cholesterol. So the common cause for anything relating to heart attack, stroke, PAD is your lifestyle, meaning exercise, diet, and also understanding what we normally eat. Next is cancers. Number one reason, if you look at the reasons for the cancer, why we develop cancer, they fall into smoking, drinking, lack of exercise, and also our environmental carcinogens, whether it's they coming in the form of food, preserving preservatives, or anything. So most of these things are happening again out of our lifestyle. So again, the second killer of in our society is cancers, and they are also related to our lifestyle. Now coming back to is the third thing, accidental deaths. Accidental death, number one reason is drunk driving. So if you look at it, if we have to set up some goals, it needs to be set up everything about lifestyle. So what are the things, when I keep on saying lifestyle, what this lifestyle means? Number one, eating right. Number two, exercise. Number three, managing your stress and keeping your emotions under control. Connect to ourselves and think. If we start exercising, now the exercise has a lot of data. You will find good and bad part of internet is if I don't want to exercise and if I put in what are the harmful consequences for exercise, you could find 2,000 articles which will tell you shouldn't exercise. Or if you want to find it out, is you could find the evidence for exercising. But one thing is very clear: the exercise should be minimum 150 minutes per week, meaning 30 minutes at least 5 times a week, preferably 7 days a week, at a speed that or at exertion level that you feel it. It's not you're strolling around. You should be short of breath. We all will be different depending on your conditioning. If some athlete is there, they may have to run at 50 miles per hour before they become short of breath. And people like me, they may not be able to walk but 5 miles per hour. But whatever to get the benefit, you must be short of breath. You must be exerting. Your breathing should be fast, and also you should feel your heart rate is increasing. Diet. It is proven over and over, and I don't think anybody needs to discuss this thing is a plant-based diet has the most evidence. I'm not saying don't eat meat. Meat to the taste, but fill your tummy with fruits and vegetables. Whenever you're planning how much to eat, your stomach has a capacity of about 4 apples. Just imagine that when you're trying to eat this, your stomach has, if you're fully hungry, your stomach can accommodate a volume as of about 4 apples. Now the question here is, if you eat pasta, you could put it in 5,000 with a lot of cheese. You could put 10,000 calories in that. And if you could fill this stomach with two-thirds of it with probably 200 calories with good quality salad, fruit, and vegetables. And key here is our diet predominantly needs to be, main bulk needs to come from fruits and vegetables, some lentils and beans, and meat to the taste. Because now what we have done is we are filling our stomach with very high calorie diets. Say, for example, what I mean to do it in nutritional science, there is a concept of nutritional density, meaning if you eat a portion of, like say, for example, 10 gram of butter will give you 90 calories and 10 grams of apple will give you 2 calories. So in your stomach, it will fill the same space and probably the 10 grams of butter will not fill any space because it's going to be all coating around the things which are already. So exercise, second is the diet. Whenever you're planning, plan for food which is high in fruits and vegetables, lentils, beans, and then in the end, meat to the taste. Then third component comes in is managing your stress. Connect to yourself, know yourself. In the beginning, I'll try to give you to kind of understanding who you are, understand what is driving you. I think in the United States, we are blessed where we have more things than anybody will need. Personally, I just want to share one thing. My visit to Pakistan about 5, 6 years ago, I went to one of the fort where the Mughals and one of the Sikh rulers used to live. Their bedroom, which was at their time was considered to be luxury, and when I compare to my own bedroom and ever thousands and thousands of houses I've lived, they were nothing. So we are living a lot more richer, comfortable, beautiful life than those so-called kings and the rulers, which I think it's a good time to be alive. It's a beautiful time to be alive, but it is amazing this prosperity, how is raising havoc on us. And I think we need to change our lifestyle so that we enjoy life for longer, quality for life. And we must make this stress management as a part of that. Then the next thing, which is the social domain of our life, what do we need? As I explained you, our body needs to rest, it needs to eat, it needs to sleep. Our mind needs to have feeling of security, emotions, hunger, fear, all those things. You need to manage that. Intellectually, our intellect needs some stimulation. Read some books, read Bible, read whatever you believe in, but stimulate your intellect. Spiritually connect with your maker, whatever your belief system is. And socially, you need to connect with others. Once our stomach is full, we are rested, emotions are under control, our intellect is under control, then the next most important thing is to connect with other people. It could be your family member, friends, group, whatever you believe in, whatever give you peace, you need to connect with that. So now, with this background, let's now talk about, as a physician, what are the tests or the things which you need to do. So let's talk about, remember I told you there are three main killers in our society is heart attack, stroke, and accidental deaths. Let's talk about heart attack and strokes. Whenever you go to a doctor, you request them to do complete blood work, which should include your fasting cholesterol, fasting sugar, hemoglobin A1C, monitoring your liver, kidney, electrolytes. And if you have a family history of some other risk factors or based on your lifestyle, your physician will do other specialized tests, but that should cover 99% of us. Then second part is this one is that one is the blood test part. If you are having symptoms, what are the symptoms of heart attack? This if you have unusual shorts of breath, chest pain, or pressure, you must let your physicians know because that could be a warning sign that you may have some blockages in your heart arteries, and your physician can understand it and can take care of them better. If your PAD will present that if you cannot walk 50 yards and you're having a severe pain in your calf, or you're having a pain even at rest, and then you see your toes are blue, you're seeing you become, when you walk, your feet become very pale. Those are all signs of PAD. Unfortunately, stroke does not give you any warning signs, but if you had heart attack, stroke, or your doctor told that you could possibly have blockages or you have symptom PAD, you are at high risk, well, yeah, of a stroke. And the way we do is a simple ultrasound test your physician can schedule if it's necessary, and they could find it out and they could help you taking care of that. So what I'm trying to say is fix your lifestyle, then blood test, and then specialized test based on your needs. If it needs to be done, your physician will get it done. Now let's talk about cancers. In the United States, according to CDC and also according to United States Preventive Task Force, there are four cancers which we are looking for. Number one is the colon cancer in both male and female. Everybody above the age of 50 should have colonoscopy. I know there are a lot of people try to, this is one of the tests I have most difficulty convincing people that they should get it. But the good part is if your colonoscopy is completely normal, at least we know that you are protected for next 10 years. And if your gastroenterologist find a polyp, they will cut it out, and that polyp will turn into cancer eventually. So that's a beautiful thing for the colonoscopy. But there are other ways it can be done. If you don't want to have colonoscopy, your physician will give you a stool card and you have to get it done every year, or you could get a Cologuard, which is 3 years. So I think colon cancer screening as we are aging is increasing. We must get colonoscopy. Our aim should be colonoscopy, or ask your physician to get the alternative colon cancer screening. Next test is in case of female, they should have mammogram, and guidelines differ according to which kind of guideline you follow. But according to United States Preventive Service Task Force, you should have at least one baseline mammogram before the age of 50. Or if you have a family history of any breast cancer, then it will start earlier for you. At 10 years, they say that if, say, for example, one of your family member, whether mother or sister have, say, at 45, if they had breast cancer, then your screening will start 10 years behind, meaning if you're at 35. But for general public, the breast cancer screening starts at the age of 50. It is every 2 years, and it stops at the age of 74. Same way, colonoscopy, it starts at 50 and stops at 75. In case of next is in males is the prostate cancer screening. This is very controversial test whether we should do it or not. Up till last year, it was very clear recommendation that without family history, we should not do PSA test. Because what happens is as we age, our PSA test increase, our PSA goes up. And when we do the test may be physiologically high, and now you have abnormal test which needs to be explained, and you will need prostate biopsies. And also in Caucasians, even if you have a prostate cancer and you're otherwise healthy, we are not sure whether it leads to your demise earlier than your other natural causes. So it is very controversial, but as I'm recording this and talking to you, it is very clear that prostate PSA test, if you want to get it done, if you this thing is your physician will not object to it, it should be a shared decision, and we should offer you the prostate cancer screening. And then for our females, you need to have a pap smear, and the pap smear starts as this thing is at at the age of 18 or when you have a first sexual interaction. And then depending on the guidelines, with if everything is going well and there's no abnormality on your pap smear, then it is recommended that it should be every 5 years, and it will stop when you turn 65. And then the fourth cancer which we screen for is lung cancer. Lung cancer screening is, I think, is going to be very important now. If you have that's if out of this video, one message I want to give it this thing for personally, and that will be the message, is that if you have smoked for 20 back years, let me explain. Meaning, if you have been smoking, say for example, one pack for more than 20 years, number of packs you smoke and number of years you smoke, if the answer is more than 20, you should have lung cancer screening. On the other hand, if you are smoking half packs and you're smoking for 40 years, and even then your answer is more than 20 years, you should have this thing is. And your physician will go over in detail those guidelines, but it is recommended that we should start screening anybody who has lung cancer screening at the age of 50, and then it goes every year till you turn 80. This is the longest the guidelines running screening which has been recommended. And the reason is lung cancer is very forgiving and non-forgiving. If you develop lung cancer, it is usually a bad sign. So let's ask for lung cancer screening and prevent it. Now we are talking next, which we talk about is accidental deaths. Number one, as I said, accidental death is your lifestyle choices. Don't drink and drive. No matter how much you think that you're good and nothing is going on, you will be uh, incapacitated. Your reflexes will be low. Your judgment will be poor. So do not trust yourself. If you drink, have somebody else drive you, or don't drive, because that's something which will be very important for you to understand. The message which I wanted to give in this live session was that in the United States and worldwide, most of the killers, which is heart attack and strokes, cancers and accidental deaths, they are predominantly lifestyle problem. Eating wrong, lack of exercise, unmanaged stress, and not connecting to ourself and our whosoever is ours. If we know our body, know our emotions, know our intellect, have our spiritual connection, and we navigate through social environment of other people, places, things, event, and time, I believe we will have a better and a beautiful life. I hope this live session added some value to you. Please comment on it. We will also record and put it on the our YouTube channel. And please subscribe to our channel. And we conduct weekly surveys, and we ask you what should we talk about every week. My goal is to go live every Saturday at 1 p.m. And this is a new experience to me too. I'm also learning how to create a better content and how to involve you so that I could read your comments and I could answer your questions live. But this is a learning process. Stay safe, stay healthy. Thank you very much.